tākou maruhiruhi, ka ruhi ana, te manu kaupapa, ka awa tihe mauri ora. E mihi ana ki a koutou te reo pōwhiri I tēnei rā. Ngāti whātua, te mana whenua o te rohi nei, tēnā koutou. E mihi ana ki te honga mate, haere atu rā. Kia tātou te honga ora, kia koutou ngā kanuhi o te ao hauora, tēnā tātou. Tēnei au, te kāwanatanga e mihi nei ki te kaupapa o te wā, tēnā koutou, tēnā tātou katoa. To our matua, Sunny and Rob, thank you for your kōrero, thank you for your welcome. Chad, thank you for your introduction. Can I begin by acknowledging Rob Campbell, who is the Chair of Health New Zealand, Rihanna Manuel, who is the Chief Executive of the Māori Health Authority, and Margie Upper, who is the Chief Executive of Health New Zealand. I acknowledge also Andrew Connolly, who's going to be speaking shortly, also senior health worker, about whom I shall say more shortly. Can I also acknowledge a couple of other senior health workers, Lawari Jensen, who just arrived. Lawari, good to see you here, and Jeff Lowe, representing GPs and primary care. Today I'm setting out our plan to deal with the growing hospital waiting lists. COVID-19 has been hugely disruptive to hospital systems all over the world, no less so in Aotearoa, New Zealand. In England, for example, there was a 200-fold increase in the number of people waiting more than a year for planned care, from just over 1,600 in February 2020 to more than 300,000 in November 2021. New Zealand has done better than most countries. Our elimination strategy not only prevented tens of thousands of deaths, it also protected our health system from being overrun, as we saw in countries like Italy and the United States. In fact, for most of the last 2 years, our hospitals have been free of COVID. We used that time to prepare the health system, to buy the new COVID-19 medicines as soon as they became available, and to get almost the entire population vaccinated. We were also able to keep our hospitals functioning relatively normally for long periods of time. Despite this excellent work, our health system has nevertheless been affected. The Delta variant that arrived in August last year and this year's Omicron wave have put our hospitals under pressure. They have coped, and I want to again thank everybody in our health system who has played a part in that. Critical services like cancer treatment and emergency departments have been maintained, but as a precaution, we had to slow down the amount of planned care, that is, the appointments and procedures that are not urgent and that therefore can be scheduled or planned. Hospitals also had to cope with the effects of staff being off work because either they were sick themselves or, as in most cases, looking after sick families or household members. Hospitals have also had to deal with the sheer cumbersomeness of COVID-19, so staff having to put on PPE gear, take it off as they move around different parts of hospitals and health services. That has added to the workload and the burden of health care. District health boards have kept working hard to see people as quickly as they can, but the latest figures show that in March, nearly 36,000 people, just under, but nearly 36,000 people had been waiting longer than 4 months to have their first appointment with a specialist. That's more than twice as many people as before the COVID pandemic in February 2020, when it was just under 15,000. The number of people waiting longer than 4 months for treatment has more than trebled, from just over 8,000 in February 2020 to nearly 27,000 in March this year. Clearly, for people who need these procedures and appointments, having to wait is distressing. It can cause anxiety, and we have to be aware of that. Now, with the benefit of having one of the most highly vaccinated populations in the world, and with the suite of new medicines available to treat COVID patients and keep many of them out of hospital, we can start to manage more of what we've got on a business as usual basis. We can build in our needs in the way we respond to COVID-19 and therefore start to deal with the planned care backlog. It is time, therefore, now to deal with the planned care backlog. Because of the upcoming changes to the health system, and because it will become their problem eventually, I am putting Health New Zealand and the Māori Health Authority in charge of the process of planning to deal with the backlog. We have an opportunity right up front to harness one of the principal benefits of the government's health reforms, a truly nationwide approach to health problems that affect us all. Today I'm announcing a high-powered task force to work up the national plan for planned care. The task force will be led by Andrew Connolly. Andrew is a colorectal surgeon, Chief Medical Officer of Counties Manukau District Health Board, and was recently Chief Medical Officer for the Ministry of Health. In addition to being a fine surgeon and health leader, he has also developed a strong track record as a health service fix-it man. So he's been involved in fixing significant problems in Southern District Health Board and the Canterbury District Health Board and the Capital and Coast District Health Board and a few others besides, no doubt. Mr. Connolly will be joined by what I think is a stellar team of health leaders. Professor Diana Safeti, the Chief Executive of Te Aho o Te Kahu, the Cancer Control Agency. We know that the timeliness of cancer diagnosis and treatment is important, and it's essential that we get this right as part of our planned care response. Wellington GP Dr. Jeff Lowe, who chairs General Practice New Zealand. And having Jeff on the task force is significant because one of the criticisms that we often get from within the health sector as well as from outside of it is the lack of kind of joined upness between primary care and hospital services. This is a chance to start that journey to bring those parts of the health sector closer together in this important task. There's also Auckland District Health Board Funding and Development Manager Joe Brown, Canterbury District Health Board Chief Operating Officer for Networks Dan Coward, Canterbury District Health Board Director of Nursing Brenda Close, Bay of Plenty District Health Board Clinical Director Linda Chalmers, and Northland District Health Board General and Oncoplastic Breast Surgeon Maxine Ronald. So this brings all the kind of hospital capability leaders together as we work our way through the waiting list. The team will also be joined by Dr. Kiki Moati, a paediatric surgeon at Canterbury District Health Board, and as I introduced before, Dr. Rawiri Jansen, the Clinical Director of the National Hauora Coalition. Dr. Jansen has been appointed to the task force by the Interim Māori Health Authority. One of the critical issues we need to do is to make sure that not only we are bringing together Health New Zealand and the Māori Health Authority and all the significant and strategic decision making and planning that we do, but also address those long-standing equity issues. And there's no question that how we manage waiting lists also have equity implications as well. The task force will support district health boards to take whatever short-term measures they can do to reduce waiting times. That will deal with some of it. But it will also be responsible for developing a national plan for planned care, which I expect to receive by September. Central to that plan will be a new national approach to specialist appointments and planned care operations, getting rid of the postcode lottery that has seen people treated differently in different parts of the country once and for all. We have one public health system, and I expect it to work together to make sure people get the treatment they need, no matter which part of the country they are in. I expect a national review of all waiting lists and a reassessment of the situation of everyone on it. For some people, that might mean they move up the list or get their treatment at a place a little further from home than they expected. For others, it might mean they are offered another form of treatment, which is less invasive than surgery and can happen more quickly. In Canterbury, for example, offering physiotherapy to women suffering from urinary incontinence secondary to pelvic floor dysfunction has meant a 30% reduction in those needing surgery. I also expect the task force to make full use of all health resources, including those in the private sector. Some of this work is already underway in various parts of the country, and Andrew Connolly will talk more about that when he speaks. What is critical now, however, is that it happens right across the health system. I've been told that if we approach this problem, the problem of waiting lists, in the same way we always have in the past, it could take between 3 to 5 years to clear the planned care backlog. That is not in anyone's interests, and it's just not acceptable. It's my expectation that we can clear the backlog in considerably less time than that. This approach reflects another important characteristic of this government when it comes to health as well, and that is that serious problems need to be addressed and to be dealt with systematically. We have a new opportunity to address these problems, harnessing all parts of the public health system. That gives us a better chance of getting people who have been waiting a long time their treatment sooner and dealing with all patients more equitably. On that note, I'm going to ask now Andrew Connolly to address you and speak about how the task force will approach its task. Nō reira, tēnā koutou, tēnā koutou, tēnā tātou katoa.
Tēnā koutou, and I'd echo the thanks for the lovely welcome. Thank you. Minister, Chair, and our CEOs, thank you. It's my privilege to chair the task force, and thank you for the opportunity to do so. I'm fortunate to be here today with colleagues, Dr. Rauri Jansen, Dr. Jeff Lowe, and our other colleagues are online. And I think that highlights the strength of this group that Jeff has flown up from Wellington specifically for this meeting. As the Minister said, the role of the task force is to provide advice and recommendations to address the many challenges on an issue that's vital to the health of all of us. Planned care is essential for all of us, be it from seeing our community health provider or general practitioner, accessing diagnostic tests from a blood test to the most sophisticated scan, having treatments that may be as an outpatient through to the most significant planned surgery in our major hospitals. For planned care, we're focusing on both the need to improve the performance of the current system in the short term, and on the need to highlight the shape and function of a better system, because both lenses are necessary, one on the near horizon and one more focused into the future. The reforms allow us this freedom of opportunity by being able to look forward without the obstruction of artificial boundaries, to work with groups in many respects that will be responsible to a single employer will make our lives easier. To work with groups who know their communities best is an advantage we must not lose. We need to introduce changes on a national level where possible. These are just to name some of the advantages we must maximise. The task force has already begun meeting. We took the letters as a sign to get going, Minister, and we've begun identifying opportunities in a variety of areas that all contribute to the success of planned care. Fundamentally, we will focus on what's right for patients, because as I have long taught my medical students and younger colleagues, what's good for a patient is very rarely bad for a clinician. Our focus on equity is a professional responsibility for everyone employed in health. We can no longer continue to accept outcomes that should and must be better and fairer. But the task force cannot do this alone, and we look forward to working with the sector and the many highly motivated and talented people within it, including those who educate, train and regulate the health workforce. We recognise the scale of the challenges we face, and we will ensure any recommendations are, in our view, not only necessary, but also realistic and achievable. We have already reported on a number of common themes from our initial discussions, and we have noted immediate opportunities in areas including establishing greater consistency of clinical priority, reducing inequities on our existing waiting lists, expanding clinical care pathways and guidelines, tidying up the existing waiting lists because we recognise some patients may have had acute care, particularly during the pandemic, whilst they've been awaiting planned care. We've noted the need to introduce more multidisciplinary approaches, and the Minister raised one such opportunity. And we need to continue to work collaboratively with the private sector on sustainable and efficient delivery of planned care. The need for a more patient-focused and equitable approach is clear, as is the need to learn from the past, especially to inform how the health system is best positioned to engage with patients and communities in regard to the delivery and access to planned care. We need to consider the changes we will recommend in light of how these must influence development of our health workforce, whilst also taking this opportunity to make health something so many more New Zealanders should aspire to be part of. We intend to capitalise on the excellent work that's already underway in various parts of the system where this has been shown to have delivered benefit. But where we have examples of success in an isolated area, our challenge is how to roll that out across the country. We'll provide recommendations to Health New Zealand and the Māori Health Authority for opportunities for implementation or, where necessary, further investigation of ideas, and for smart investments to improve and expand planned care. We believe our initial work aligns with the ongoing development of the New Zealand Health Plan and reflects the Health Plan's strong focus on equity. Again, on behalf of my colleagues on the Task Force, Minister, I thank you for the opportunity granted. Thank you.
Tēnā koe, tēnā kōrua. Thank you, Andrew. So, mention of both Health New Zealand and the Māori Health Authority. I mean, as we rapidly approach the 1st of July and the beginning of the next stage in our health system, we turn to, Rob Campbell as the chair of the Interim Health New Zealand Board. The board who have been spending, many hours over the last few months preparing their team and working with and bringing Margie and the team on board to prepare for 1 July. So to you, Rob Campbell, welcome you to the podium. Tēnā koe.
Kia ora tātou, Minister, and fellow workers in the health sector, because that is how we see us all now. We're all whānau working for a common goal as between Health New Zealand and the Māori Health Authority and our communities. Health New Zealand is committed to building a health system where people get the health care they need, when and where they need it. As the Minister has highlighted, the system has struggled to meet the demands for planned care. Some types of treatments and surgeries are deferred, especially when urgent surgery is needed, for example, to save someone else's life. But deferring too much planned care is negatively impacting the lives of Kiwis, and it needs to be addressed. The creation of a truly national health system presents an opportunity to do things differently and to lift health outcomes as a result. There's a great depth of talent within our health system. We have professionals that are at the top of their game, and they're providing invaluable support, guidance and treatment every day. So what we're doing here is tapping into some of that talent and expertise to address some of the biggest issues our health system has faced. Planned care is the first cab off the rank, if you like, because we need to make immediate improvements in this area. The members of this task force have excellent reputations and experience relevant to planned care, and they will provide the expert advice that is needed to stabilise planned care and to reduce waiting lists. To those members announced today, thank you for agreeing to come together to tackle this challenge head on. I have no doubt that we will soon reap the rewards of your insights and collaboration. The reform of the health system is making it possible for us to tackle planned care from a national perspective. In addition to tapping into the talent we have across the health system, the reform will also make it easier for us to take the action that is needed to change the situation. At the moment, more than 20 different entities are all making decisions about what happens in our health system. In July, that will change, and we will have a united and simplified health system. It will be a system which is nationally coordinated, regionally delivered, and locally tailored and whānau-oriented. And it will make addressing challenges such as planned care much simpler. For example, we'll be able to easily identify areas where things have been working well and replicate them across the country. We will be able to standardise approaches across the country, and we will be able to take a national approach to the capacity we have within the system. So if care is needed but unavailable in one area, we can look across our national hospital network to see where that care could be provided. And this is the benefit of a truly national health system. The key for us is to ensure that efficiencies like this come to fruition. the health system hasn't been short of reports. What we've been short of is successful actions. And I think you could pick up already within what the Minister has said and what Dr. Connolly has said, that as this work proceeds of this group, we will start to implement actions as they become identified, and we won't be waiting for some longer consideration. I think about this partly because I'm a cricket fan. A lot of what we're doing in the health system is like 5-day cricket. It has to be planned and approached in quite a careful way. But there are some things that need to be dealt with like T20, where there are lots of runs to be scored and scored quickly. And in this planned care area, that's one of them. The national approach will also support innovation across areas that may have previously been a barrier to improvements, such as developing the workforce we need to meet the demand. With the old district health board structure, see, I'm slipping into that language already. With the old district health board structure, competition for resources and duplication of services between regions is a challenge. With a unified health system, we have a team of teams, and we will have the opportunity to consider how different teams can be supplemented with the skills and capability that exists within another area of the health system. In Health New Zealand, our focus will be aligned, and we will be working together towards the common goal of Paiora. This is a once-in-a-generation reform of the health system, and it will lift health outcomes for all New Zealanders, with a strong focus on lifting the health outcomes for those who are being left behind in the current system. When we talk about a focus on whānau health, we include within that the intense focus on getting equity into our health system, into the actions, into the processes, and most importantly, into the outcomes of the health system. Addressing planned care is an important part of the work we have ahead of us. I'm confident the team that's been brought together to address this challenge has the skills and capability to provide the strategic direction that is needed. Thank you again to members of the task force who are here and who are online. We really appreciate what you're doing for your community. I look forward to working with you over the coming months. Thank you.
Tēnā koe, Rob. And with those words, a reference to whānau and words of reference to equity, those will resonate heavily and echo throughout the Māori sector and Māoridom, and with our Pacifica colleagues and those in the rural areas as well. And it's in that vein that I'd like to turn to Rihanna Manuel, Mārei Kura Tumu Whakarai, and her colleague Margie Apa. These are the two leaders of the Māori Health Authority and Health New Zealand who will take, I guess, the organisations forward and take our health sector forward together, working tightly, as I know they already are. Nō reira, Rihanna, Margie, tēnā korua.
Tēnā koutou katoa tuatahi, e rere atu tēnei mihi ki ngā manu tiore e te kōrua, ngā mihi kia tika mo tō reo mahana, mo tō reo aroha, e awhi e tautoko ana i a mātou i tēnei rangi, e mihi atu ana ki a kōrua. O tira ki ngā manu e noho ki rungi te pai, me koe hoki i matua sani, e rere mata kui ki a kōrua. Mō ngā kupu e aki ana tēnei kaupapa. Ka huri te kai o te waka ki a koe e te minita, e mihi atu ana mō kupu, mō whakaro i roto i tēnei au huri. Me kōrua, te man with the plan, Mr. Connolly, nei ra te mihi ki a koe, me koe hoki taku boss tuatoru. Ka huri ki te reo Pākehā i nei, ki te whakamārama i a koutou hā te aha. Firstly, a huge warm welcome to you all here, both online and in the whare, i roto i te whare. But I just wanted to pay homage to our kaikaranga in the first instance. It's always a beautiful and welcoming sound to hear the reo of our wahine, and you know you've arrived and you know that you're in a place that fully welcomes you. And it's extended on by our pai manu or our kai kōrero. And of course, from this humble wahine to you all for the very warm welcome into this whenua taurikura. I thank you very much. So I stand here today with my fellow colleague and Majiapa, and of course the basic tone of my kōrero is to really underline the point of equity. To ensure that, I'm not going to repeat the promises that have been laid out within the task force, but really the Māori Health Authority is trying to make sure, and we're going to be ever vigilant around making sure that we reduce those inequities that currently exist in the system. And some of the things that we have to acknowledge is that first, when we look to this taumaha kaupapa, which just means heavy kaupapa, is that we have to understand that they actually exist. We have to acknowledge their existence. We have to then plan for a way that levers a few things. The system, once we acknowledge that inequities are inside of our systems, then we go forward and we start to push the system to put all of the levers in place that will reduce those inequities, that will ensure the people who need the services most get the services in a timely fashion. And as you've heard today, that's what planned care is all about. But I would push it one step further and say that in making sure that we do the planned care conversation whilst we bring this national system together, it is time for innovation. It is time to look for different solutions, and those exist within the hapori, our hapu and our iwi and our communities. We will find solutions there that we probably didn't think of, and quite frankly, during COVID, we started to see the rise up of that. What I want to ensure is that we don't lose those opportunities, that we continue, as my colleague says, to grip up every one of those opportunities, and we make sure that we move forth in a way that if we acknowledge he hua Māori, he hua Aotearoa, what is good for Māori will be honestly good for all of Aotearoa. Engari, i tēnei wā, I'm going to hand this time over in the true spirit of Te Tiriti, though we acknowledge that we are a Crown entity, both the Māori Health Authority and of course Health New Zealand. We want to make sure that we model at every level good partnership. Anei wā.
Tēnā koutou katoa, ngā mihi mahana ki a koutou mō tēnei kaupapa. I echo the honours acknowledgements of our distinguished guests, our welcome, and all our colleagues who are here, Minister, my chair, and Andrew, no pressure to you and your team. Look, I'm going to end by really just expressing our thanks. And my message goes to the more than 200,000 health professionals who are in the sector over the last couple of years who've been toiling not just within their own settings but across the system to make sure and echo the Minister and the government's priorities to keep our communities safe, maintaining as much of our services as we could. And after the first couple of waves of COVID, we were able to maintain as much of our planned care, but our evaluations and learnings told us that we did that sometimes at the cost of our teams. And so we want to take a planned and systematic approach to planning care this time round, not just to assure our communities that we are aiming to do all that we can to provide planned care, but also that we are supporting our staff and our workforce to be able to deliver that, but also keep their well-being at the top of our minds. So I want to acknowledge and thank, in anticipation, all of our teams in the health sector and community and primary care and hospitals, and all of our colleagues in private sector hospitals. We are calling on you all to step forward and support the task force, and I want to acknowledge those who have already reached out. Thank you, Private Hospital Association, and others, colleges, who have reached out to say you want to help, and we will be reaching out to you to invite you to work with us. I also just want to acknowledge and thank our communities and patients who have been waiting patiently, and our aim as a unified health system that works together as teams across geographic boundaries, across professional boundaries, and across communities to offer you as much certainty as we can as quickly as possible over the coming months and year. So thank you to all of you for your patience, and thank you for your time today. Nō reira, tēnā koutou, tēnā koutou, tēnā tātou katoa.
Tēnā tātou, tēnā kōrua. Look, so that brings us to the end of the official proceedings this morning. So to you, Andrew, Rauri, Jeff, your peers, Linda, Kiki, Maxine, I'm sure I'm going to forget a few of the others, all strength to your arm, and no challenge. So we're going to, I'm going to ask e te papa mahaura e whakakapito tātou nei hui, and then after that invite our guests here to partake of tea and coffee. The minister and others will have some time with the media then. Nō reira, tēnā tātou, te minita, Rob, tēnā koutou.